All right. So yeah, welcome everyone. Been meaning to having us, start the presentation off with talking about what exactly we're discussing today, which is pelvic pain. I was just having a discussion with Lockie, and this is an area that doesn't really get spoken about too much. So pretty keen to discuss more on this topic and get people understanding of what might be causing their pain, and potentially implement some strategies to try to overcome their discomfort as well. So we'll get stuck into it, and firstly we'll just talk about what exactly we're discussing today. So we're going to go through some definitions of what pelvic pain is, why it's important, some common signs and symptoms to watch out for, how to diagnose it, who to see for a diagnosis, and then just some really generalized information about management of pelvic pain. And probably most importantly, which will apply to most people, is how to prevent it. Prevention is always better than cure. So how do we not go down this track and keep ourselves healthy and happy as we age? So definition of pelvic pain is essentially any pain within the vicinity from the penis all the way to the anus. So it could include anything in between or anything around that area, even towards the coccyx or the sacrum, so the lower, very lower part of the spine. And it's often chronic in nature. So chronic is defined as greater than 3 to 6 months. And usually it's accompanied with pelvic floor dysfunction, which I wanted to include the definition of that, which is essentially muscles are too tight or weak or uncoordinated, and that can often cause symptoms in itself of urinary dysfunction or even sexual dysfunction. So they're the definitions. We'll go through exactly what might be causing some of that pain. I think that might be in the next slide we discuss. It's quite a spoken about issue within women's health, but yeah, not enough men speak about it these days. So it's really important to spark these conversations and understand that there is help out there for it. So there can be a number of causes of pelvic pain or contributing factors of pelvic pain. So can be prostate-related conditions. You could have what's called prostatitis, which is an inflammation of the prostate generally caused by infection. You could have some irritated nerves around the pelvis, which could contribute to symptoms of burning sensations or even numbness around the pelvis as well. It could be some referred pain from your lower spine or your sacroiliac joint, which is where your spine meets your tailbone. It could be hernias. It could be things like sexually transmitted infections. There's a whole range of different things that could be contributing to your pelvic pain, which is why it's really important to get an accurate diagnosis and make sure you do all your checks with your GP or your urologist, just to make sure that it's nothing sinister, and yeah, you can rule out all of those more serious type conditions.
Can I just chime in there, mate, and ask what's the most common that you see out of the bunch there?
Yeah, so the most common would be prostatitis, which is inflamed prostate. People can get chronic prostatitis, and it can be a recurring thing. And often when the prostate becomes inflamed, it can become painful, and then you can get into a bit of a snowball effect whereby your pelvic floor muscles then can spasm and tighten up in response to that pain to protect and guard, and sometimes that can then even spiral to urinary and sexual health dysfunction. So that's probably the most common. Other things like urinary tract infections can also sort of spiral down that pathway. Otherwise, I see a lot of sacroiliac joint dysfunction too, which is where, again, the spine meets the tailbone, and sometimes people can have quite stiff sacroiliac joints, and that can often cause nerve issues around the pelvis too. So they're probably really my top three: prostatitis, urinary tract infections, and sacroiliac joint dysfunction.
Beautiful. Well said, mate.
So you can see from these two diagrams, the first one on the left, there's a lot of nerves that wrap around the pelvis and sort of go in between ligaments and go in between muscles. So there's a lot of different sites of compression and irritation that can be put on those nerves. And so, yeah, you can see the complexity of it. So just on that note, pelvic pain is usually very, very complex. It involves, not only the pain sites, but a lot of psychological factors, because it's generally quite a sensitive and intimate area. So people tend to worry about their pain a little bit more. So it's always good to get a multidisciplinary approach to this. And a lot of the people I see with pelvic pain will also be referred on to psychologists to try to reduce that psychological factor. And that can often help desensitize those nerves that are irritated and causing the pain. You can see on the picture on the right that there are other sites of pain within the pelvis, the prostate being one of them, as we've discussed, bacterial prostatitis. You can get an enlarged prostate that can often cause urinary issues. People can get pain post-vasectomy as well. And sometimes people can get scarring within their urethra from a whole bunch of different things, but sometimes some surgical procedures, which can also cause some pain as well, and that's called a stricture. So there's a lot of different things to think about here, which is why it's important to get an accurate assessment, rule out the more serious things, and then once they've been checked over, see a physio to try to manage your symptoms. And there's a lot of different umbrella terms you might come across with pelvic pain. We've spoken about a couple of them already. Prostatitis, you can get chronic pelvic pain syndrome. There's pudendal neuralgia. There's chronic testicular pain. There's all these umbrella terms, and it's sometimes hard to distinguish why people get them or what's really causing them. So that's why it's important for me, once they've been checked for the more serious things, just to treat the condition that's in front of me, as opposed to, the actual diagnosis, because it can be caused by different things, but come under the same umbrella term.
When it comes to the pain, is it always, I guess, would you say that it's very obvious that you would know that you have an issue and then you need to look into it? Or would you say it could be so subtle that you're like, it's probably just normal?
Yeah, it can come in various different forms. I've seen it where it's quite debilitating and people can't sit down for more than 10 minutes at a time. I've seen people where it's just a low level sort of dull ache, and it's just enough to keep them awake at night. So yeah, it comes in a whole bunch of different forms. It can be sharp, it can be dull, numbness, tingling sensations, intermittent, can be quite random. Yeah, it's a bit of a mixed bag, to be honest, but yeah, that's my job, is to try to sort of figure it out and try to get them on the right path for recovery. Yeah.
15% is pretty big number as well, isn't it, really?
Yeah, up to 15% of men, probably be more, because it's probably under recorded. As I was saying to you, Lockie, before, a lot of men they'll go to a GP and a urologist, and they'll get all the bloods done and urine tests done, and even MRIs and CT scans. A lot of it comes back negative, and the urologist or the GPs might be a bit puzzled at that, and some of them refer on to physios, because they're more aware these days of the pelvic floor dysfunction having an influence on people's pain, which doesn't necessarily show up in tests. So yeah, it's probably a lot higher than that, I would imagine. And we've sort of covered that second point there as to why. It's most common in men aged 30 to 50. I suspect it's because people in that age probably don't really want to see a doctor, or males anyway. Once you get over 50, people are a bit more conscious of, why have I got that pain there? Like, I should probably go get it checked out. But in that age, everyone's busy and everyone's working, and everyone's so easy to just to push it to the side. And so that's probably why it's most common. But also, people are most active in that age as well. And we know athletes in particular are at a higher risk of pelvic pain because of the repetitive stress that they put on their core and their pelvic floor. Straining a lot, even pressure with the cyclist. There's a lot of pressure in the perineum that can cause, disruptions of, some of those peripheral nerves that run through that area. Also performance stress as well. Like some athletes, stress is a big contributor to pelvic pain because similar to how people hold stress in their jaw or their shoulders, some people hold stress in their pelvic floor. And so that's another reason why athletes can get more symptoms of pelvic pain. And another big one is, poor technique, and a lot of people might focus on the bigger global muscles around the core, the glutes, the big abdominals, but they don't focus on the deeper core muscles. And another reason why athletes tend to experience it more is because some of them train with poor technique in the fact that they're, performing a Valsalva maneuver. They're not actually breathing through their exercises. And breathing's important because if you hold your breath, you increase intra-abdominal pressure, which actually places a lot of strain on your pelvic floor as well. So there's a number of different reasons why athletes are at a higher risk. But it's a pretty important point, I guess, for them to be a bit more mindful of it.
I feel as though in this generation as well, a lot of people are more about the visual gains or like fat loss, muscle gain, when really they probably don't even know what a pelvic floor is or how to use their pelvis or anything like that. It's definitely something that we need to work on. I think the whole topic like we talked about is very taboo for sure.
And the pelvic floor is essentially part of the core system. It basically just forms the floor of the core, right? And so you don't really need to train it in isolation. If you focus on, general core exercises, you're probably getting a little bit of it involved with it. So it doesn't need to be anything fancy. Some of these ads on Facebook and Instagram, telling young kids and targeted at adults to strengthen their pelvic floor as hard as they can. That actually, we'll get into this a bit later, but that actually causes more pelvic floor dysfunction in some ways because they just go nuts with it. Training your pelvic floor within your core routine is an important part of your training to help prevent pelvic pain. That's for sure. Yeah. Do you experience any gym goers that get pelvic pain much there, Lucky?
Not too much, to be honest, but it could be a topic that some people aren't open discussing enough, even with a coach or someone close to them. I think, again, it can be quite a taboo thing, and for it to come up, it needs to be quite significant, doesn't it? So I'm not coaching too many athletes probably over 40 or into 50s. For me, it's more 25, 30. So it's not something that arises too much. We definitely allocate for it. But yeah, man, it's not something that comes to mind.
Maybe you're a good coach.
Maybe I'm a good coach. I hope so.
Because like I was saying, mate, like it's sometimes it's just people doing, they might be performing their technique the wrong way and not breathing through exercises or, overly straining themselves when they should be a bit more relaxed. So technique does play a role in it. Yeah,
and for me, it's probably more about having like a dynamic mobility warm-up, including dead body weight core stuff. And then instead of just going to your hard lifts of deadlifts, squats, all those fundamentals, it's more about doing unilateral work, keeping it a little bit lighter, accumulating more reps, getting their scaps and serratus to work a little bit harder.
Yeah, nice.
But yeah, man, I think this would definitely be an issue, like you said, in the ages of 30 to 50. I know for a fact that if I get a sore neck or if I get a sore back, it can be very easy to be like, sort it out tomorrow. And then tomorrow goes into the next day, and the next day, and it's more significant.
Yeah.
For sure.
So common signs and symptoms that people might describe or that you might feel. So like I said, within the definition itself, it's not necessarily pain. It can be, tingling, numbness or burning sensations within that sort of pelvic region. But we know it can be associated with issues with your bladder, bowel, and even sexual function. So you could have pain with urination or even after ejaculation, trouble stopping urine flow or frequent urination. You could sometimes experience incomplete bladder emptying as well. Erectile dysfunction, because sometimes your pelvic floor can become really, really tight that it almost, occludes or restricts blood flow to the penis. And so that's something that I've seen again in the younger population. And so those are the guys that tend to come across these Kegels or pelvic floor exercises that online, and they might be noticing that their performance isn't as good, and all of a sudden they come across this ad, the phone's been listening to them, and they go hard with it, and it often makes their erectile functional strength worse because they're just tightening up so much. So yeah, it's important to once you know that nothing serious is there, is to see a men's health physiotherapist, and if pelvic floor exercises is something that you want to try to do or that might benefit you, you get taught it properly with an ultrasound instead of just going health leather. Yeah.
Can I jump in, man? And I just want to ask a really important question that I just thought of then, and I've never thought about before as well. Does that mean that a lot of people that are using like Viagra or Cialis or something like that, or a compound, does that mean that they could probably fix it just through natural remedies rather than just taking a drug to essentially create more?
For sure.
There? I've never thought about it like that. Hey, that's so interesting.
100%. Like I saw a guy not too long ago, and yeah, there's a lot of lifestyle modifications that you can actually put into place for people with erectile dysfunction. It's not necessarily just stress that could be causing a tight pelvic floor, overly straining that could be causing a tight pelvic floor, but sleep and exercise, resistance training, and getting enough exercise in can help as well. And so no, but with the guys who have tight pelvic floors, they often get, or erectile dysfunction from tight pelvic floors, they often get prescribed a Cialis or a Viagra, which can help to actually relax the pelvic floor in itself. But I saw a guy recently who we just went through some down training and some gentle stretches, and he was able to relax his pelvic floor a little bit more and come off the medication and experience an improvement. So
just like Panadol and water, I guess, for a headache.
Yeah.
Sorry, and one more question. When you say down training, can you explain that a little bit more, if that's okay?
Yeah. So we'll get into that again, but
okay. That's all right if you got it in the pipeline. That's cool.
Yeah. We'll talk about it. Yeah, we'll lead into that. But yeah, that's an important starter, or even a mid-stage exercise to incorporate into people's training who do have some degree of pelvic floor tightness. All right, so moving on to diagnosing pelvic pain. So as I've mentioned before, it's really important to get screened by a GP who'll probably refer you on to a urologist just to make sure that you don't have any of the more serious conditions. So a few red flags to look out for: any degree of blood in your urine or your semen, any severe pain, especially keeps you up at night, or just severe pain in general, sudden or unexplained weight loss, neurological signs, so numbness or weakness, and severely altered bladder and bowel function also. So you might go to a GP and then urologists, and they might do your normal blood and urine tests, and maybe even a prostate exam, potentially some ultrasound as well, just to, again, rule out the more serious things. If they don't find anything from those from those assessments, from their own assessments, then they'll tend to refer on to a men's health GP to screen them from a musculoskeletal perspective and work on trying to settle down any contributing factors from muscle spasm, muscle tightness, or joint stiffness and whatnot. So this is going to be a very generalized approach. Like I said, there's a whole bunch of different pelvic pain categories or factors that are contributing to pelvic pain. So each case is quite different. But these are some generalized exercises that you can incorporate into your routine. If you do have pelvic pain, maybe even just to give you a bit of a head start. So we'll talk about it in 3 phases. So early stage management for the first couple of weeks, just to aim at reducing triggers, trying to calm the nervous system, and just trying to take the edge off the pain, really, to stop some of those behaviors. And then in the mid stage of your management, focus on restoring movement. So we might incorporate some stretches of the pelvic region. We might start working on improving a bit of muscle tone. And then the final stage, or long-term management, aimed at trying to return to activities of daily living or hobbies that they might find they enjoy, or just getting back into some regular training with reducing their risk of recurrence. So the first 2 weeks might stretch out a little bit more if they've had their pain for a longer time. The longer you tend to have your pelvic pain, the longer it takes to get better. And it's always a bit of a roller coaster as well with pelvic pain. It's not always linear. It tends to be a bit up and down, but you just want to make sure that, week to week or even fortnightly, people are getting some degree of improvement. So in the early stages, for the first couple of weeks, like I was saying, avoiding triggers such as sitting down for long periods if that causes you pain. I tend to incorporate a lot of breathing techniques, one of them being diaphragm breathing, which we'll go through in the next slide. Pelvic floor relaxation exercises. So this is something that you brought up previously, Lucky, and these exercises are not done in an aggressive or vigorous way. It's essentially, think of it like a P&F stretch to some degree, but a really light one. What we're trying to do is contract the muscle to focus on the lengthening or the relaxation component of that contraction, not the actual contraction itself. So instead of contracting your muscle as hard as you can, you contract it at about maybe 30% of your maximal effort, and then you might hold that contraction for 2 seconds and you might release it for double the amount of time, so 4 seconds. And being aware of where those pelvic floor muscles are and how to let them go can be a really good strategy for people who are quite reactive or tight with their pelvic floors. And your pelvic floor is a little bit more complicated than what people think. It's not just one muscle. You've actually got a few different muscles down there. You've got some muscles around the front passage, so around your urethra or your penis, and then you've got some muscles around your back passage. And so it's important to try to train them as different muscles to try to relax the whole thing, or the whole system, I guess you could say.
Can some people unintentionally just get through training their whole life and have no pelvic pain just because the manner they've trained in? Not saying it's an educated manner, but it's just the fact that they have been, I guess, avoiding some lifts that are problems for pelvic pain.
If they've gradually increased their gym routine, and they've got good technique, and they're breathing appropriately, they haven't had a long period of rest and then come back too quickly. If they're doing all those things, then yeah, for sure. You should be able to go through your whole life without experiencing this. And we'll go through some preventative strategies in the last few slides. But yeah, if people have had educated and they've had a nice gradual increase to their training, then yeah, you shouldn't really experience it.
For sure. Cool.
So moving on to the mid stage. So before we do that, the diaphragm breathing technique, this is a good little strategy to do at home, even just from a meditative perspective. So it's called box breathing. So you breathe in for 4 seconds, and mind you, it's breathing from the diaphragm. So when you breathe from the diaphragm, your lower stomach expands. You can see those pictures where they've got a hand on their upper chest and one on their lower stomach. The upper chest actually stays quite still and relaxed, and the lower hand is the one that expands outwards with the breath in. And as the diaphragm comes down, the pelvic floor actually becomes lengthened, or I guess you could think of it as a stretch on the pelvic floor. So that's why this exercise can help relax the pelvic floor muscles. And the box breathing is done in 4 stages, where you take a deep breath in and let the lower stomach expand, and you hold that for 4 seconds, breathe out slowly for 4 seconds, and then hold that for 4 seconds. So even if you did that for 5 minutes morning and night, so that could be a nice preventative exercise to do. It can also help reduce, central nervous system drive and potentially the effect of stress as well.
How many people do you think you allocate box breathing to and they don't do it?
Not many. I think most people are pretty open to it because they want to get change. They want to experience change.
It is, the reason I say it, though, is even for myself, sometimes I've set tasks of doing it and I don't get it done. It's like 5 minutes morning and night is phenomenal. Like that's really good, isn't it? It's the reason I bring it up in today's lifestyle, I find it very hard to stop and breathe. But it's so important, and just shows that we just don't do it enough. Yeah.
The thing I use in the appointments is an ultrasound. So people can see from the ultrasound assessment how it helps to lengthen out their pelvic floors. And so they kind of get the buy-in from that. And so then they realize, I guess, how important it is for them in managing their symptoms. So if you don't have pelvic pain, probably would be less motivating to do it.
I agree. So, and you'd start them at 5 minutes morning and night, or you'd start them at like 2 minutes and then work your way up?
Nah, I always say 3 to 5 minutes. Try to make it realistic. Yeah.
Happy days.
So moving on to the mid stage. So weeks 3 to 12. And again, this is just rough. We just want to manage stress and make sure, they've got some strategies for that. Mobilizing the hips, around the hips, so trying to release and lengthen the adductors, that can often help. And it depends where they're tight. So I'll do an assessment on them, but the stretches I allocate are quite specific to that person. So they might continue with some pelvic floor relaxation, and then we can also introduce some graded core exercises, just to again try to build slowly their core strength to help prevent recurrence and just develop a bit of a routine moving forwards. So some of these stretches are on this slide here. So they're quite simple to do. The first one's more of an adductor or groin stretch. The second one is more of a lumbar extension for the front part of your abdominals. And then we've got a hip flexor with a bit of overpressure. And then the last one you might want to do in a quiet place because it looks a bit weird. But it's called a happy baby stretch. And that one's actually, it feels really, really nice, but it can be really effective for people who hold a lot of tension down there or have tight pelvic floors as well. So give those ones a crack. But as I said, some of them will be more effective than others depending on where you're tight and we're experiencing tension in your body. So final stage in long-term management, so trying to guide a safe return to training or hobbies, whatever they might be for that person. So, reintroducing gym exercises, postural training to learn the correct technique, making sure that they're learning how to breathe with their functional strength training as well, incorporating that into their daily routine or weekly routine, whatever it might be. And then having some strategies also to minimize the impact that stress might have on their pelvic pain too. So, whether that's some breathing exercises or mindfulness exercises, that always goes a long way as well. So I've just chucked a couple of different exercises in here. Again, you don't have to do anything, this advanced or fancy if you think this is advanced. It's not that advanced, but doing something like an RDL or a pile-off press or something like that, just to try to think about your technique and hinging at the hips and not placing excessive stress through, the spine, and then with the squat and the bands, just trying to engage your core muscles gradually and introducing them into your workouts can help as well. It could just look like a free range squat with a barbell or a couple of lunges with some dumbbells. It doesn't have to be anything too advanced, that's for sure. But it could just be something simple as that and breathing through those exercises. So this is probably most relevant to the wider population because, as we know, only sort of 15% experience pelvic pain, but how do you prevent it? So staying active, for starters, it's easy for males in their 30s to 40s to become quite sedentary. So staying active can help promote blood flow and help keep muscles lengthened and relaxed, and doing appropriate warm-ups and cool downs can help as well to prevent any sort of straining or potential injury. Avoid excessive breath holding, which is something we've spoken about as well. So making sure you're breathing through your exercises. Prioritizing sleep, hydration, and stress management. For those that like cycling, get a bike fit or have a chat to a bike technician about seats, because there are seats that can help offload the perineum and allow you to sit more on your sitting bones to prevent any pelvic pain. Maintain good posture throughout your day. Posture can sometimes place a bit of strain on the pelvic floor as well, and contribute to pelvic floor dysfunction to some degree. And the last point, avoiding aggressive pelvic floor exercises, which is something we've spoken about before, can often make the situation worse. So don't do that. So when to seek help if you do have pelvic pain, if you have any of those red flags that we've mentioned previously, if the pain is persistent over 6 weeks, if it starts to affect your daily life, or you're experiencing no progression with trying some of the strategies I've mentioned, or self-research or whatever it might be. When you do seek help, the support team might include a physio-urologist, a psychologist, maybe even dietitians for those that have irritable bowel syndrome too. It tends to be very multidisciplinary when it comes to pelvic pain because, as I said, the psychological factors can often be involved and influence people's pain and change behaviours. So it's important to include a bit of a team when managing this. So key takeaways. It's common more so in the athletic population, but up to 15% of males can experience it. Early care, better outcomes. The guys who I've seen who have had it for years and years on end, it's tricky. You've got to be consistent with the interventions, and you've got to try a few different things before you get it right. So the earlier you can get on top of it, the faster you'll recover. And the more chances you have of making a full recovery. Movement, awareness, and support matter. Movement's a big one. So yeah, keep moving. Might just be a walk in the afternoon for 15 to 20 minutes, but better than getting home and just switching on the TV. You've got our bodies are designed to move, so it's important to get that in. And yeah, normalize the conversation. If your mates tell you about their pelvic pain, let them know that there's people out there that can help, and that they should get help for it. Even if they've hit a few roadblocks and they've spoken to urologists or GPs and they've come to dead ends because they haven't found anything. Tell them to keep pushing and maybe have a conversation with the men's health physio at the very least.
And they could literally message you straight away, right?
Yeah, shoot me a message. You don't have to book an appointment. If it just means asking a question, I'm always happy to help out. So, if I need to do a face-to-face and actually do a proper assessment, then I'll get you in the clinic. But if it's a question here or there, then I might be able to assist you with. Then yeah, feel free to message me. More than happy to help. So, questions? Did you have any, Lockie, yourself to start off with?
Yeah. Let me think about what is the biggest golden nugget I would like to attain.
Okay. Well, you have to think about it. I wrote down some of the other ones.
Yeah, cool. You go for it.
That were asked. Some of them have been answered. One of them was, I have an electric feeling down my belly button. And I'm assuming they meant when they stretched. Is it related to pelvic pain? So, so sometimes people can get nerve-related issues that can cause that sort of electric or that sharp feeling. So it could be an abdominal cutaneous nerve entrapment, but you sort of have to try to get that assessed. Could be something a little bit more structural, like an umbilical hernia. It could be the effect of a urinary tract infection. Sometimes they radiate out a little bit further as well, or even something a bit more serious like appendicitis. I would go to a GP, get yourself screened first for some of those more physical things. And then, if they don't find anything too serious, it might just be a bit of a nerve irritation. So seeing a physio could help with trying to prescribe the appropriate exercises for that. The second question was, what's the most common reason that causes pelvic pain, or common condition that causes pelvic pain? We've answered that. So prostatitis, I would say, is the most common condition. Urinary tract infections and sacroiliac joint dysfunction is what I see, but there can also be hernias and irritable bowel syndrome as well. There are a couple of other common ones too. And so the last question were, what are some of the signs and symptoms of pelvic health issues, and what do we look for? So we've stressed that as well. So any sort of pain or burning or numbness around the pelvic region can happen with or without bladder dysfunction, bowel dysfunction, and sexual dysfunction. So they were the main ones. Yep.
Is there any specific exercise you don't like an individual doing?
For pelvic pain or just in general?
No, for pelvic pain, or that might put them at a risk. Let's say, for example, you have a 50-year-old male that has had pain in the past. He doesn't have pain at the moment, but you're probably managing it, assuming it could come back. What exercises would you not like to see him do? Okay.
So number one, I'll probably tell him not to do pelvic floor exercises, just as a preventative in itself. And if he wanted to pursue something like that, maybe he come across it for other benefits, but just a mental health physio. The second thing, from a training perspective, I just wouldn't do anything that involves less than like a 6 rep max or something like that. So not doing anything that's going to cause a lot of strain, and depending on
it's a high risk for reward, really. Like if you're going under 6 reps to achieve what, with like a
I know.
highly detrimental outcome as probably the biggest thing that could come out of doing 5 reps.
I know. Yeah, I know. But sometimes people enjoy it. I traded a 60-year-old powerlifter the other day.
Yeah.
So sometimes people like doing it as a hobby, but yeah, I wouldn't be recommending anything really, really heavy. And depending on his control and his technique, you know, I probably wouldn't be recommending any heavy free weights in particular. You know, if he might start off by doing some lighter free weights, or by doing some machine weights, and build up a bit of base strength first before, you know, doing anything moderately heavy with free weights. Yeah.
So similar sort of philosophy as to what I would have, in the fact that you would rather not remove exercises altogether if they still want to. You let them do it, because if they do less over time, they'll just say no to a lot of stuff and they won't be able to function properly, right?
Yeah, movement's important. Like you've got to move. Like, you know, you're at more risk of other health conditions as well if you're not moving. So movement is key. You've just got to adjust it, and you know, it means starting slow and building up gradually, and incorporating, you know, a bit of core stuff on the side. And again, it doesn't have to be really specific with the core stuff. It can be anything, as long as you're targeting, you know, that system and building up your strength gradually. Then, you know, you can't really go wrong.
All right. Biggest motivation for why you do what you do?
Good question. I think it's just providing a service that not many people think exists, and having people, having a service that people can use and benefit from, and normalize as well. I get a lot of fulfillment out of the work I do, and people are very thankful when they get results, and that sort of drives me to keep going with it. And a lot of the time, you know, towards the end of their journey with me, they say like, "Oh, I never knew, you know, there was a branch of physiotherapy like this out there." Or they might say that, you know, they didn't think that there was anything that was going to help them. So that's why I want to do it, just to make sure people know that there's someone out there that they can see.
Mate, well said. And coming from someone that I had different issues, but having infertility issues, when you can start talking and start actually understanding it, it makes life so much easier. So and we've talked about this so many times, but what you're doing is very powerful, man.
And another example is, like, a lot of the young kids, especially, they sort of spiral with their thoughts, and they might think that, you know, it's something a lot more serious, or they get really anxious and worked up because they haven't necessarily found answers. And I've had a couple of people in the past where you just sit down and you explain to them what's happening and educate them. And like, you don't do much. You just educate people, and I'll see them again the next time, and all of a sudden they're 95% better. And it's just from understanding. And a young kid said to me recently, he's like, "I think I just understood what was wrong, and that's just reduced a lot of the stress and anxiety for me." And he was pretty much better the second time.
Yeah, so, stress and anxiety can cause an array of problems, right? That could be the only issue.
Yeah. So yeah, that's why I want to do it, just because I want to make this service available to people, and I think it's an important service to try to spread awareness about.
Love it, man. Yeah. Well, thank you so much, man, for your time. You've
That's all right.
Anything else you want to share, or any other?
No, not really. Pretty much got everything out I wanted to get out. We'll probably be discussing a few more curly topics in the future, you know, around ED, and even around potentially some bladder issues, or the topic of prostate cancer. So all of which are a bit more common actually than pelvic pain itself. So yeah, stay tuned.
Sweet, man. Thank you so much. We really appreciate it. And
no worries.
Keep up the good work.
Yep. Cheers. Thanks everyone for attending. If you need me, feel free to contact me.